Self-isolation and quarantine of the COVID-19 pandemic will lead to a tsunami of emotional and psychiatric disorders. Psychiatric experts are predicting this now. They say that the measures increase loneliness, anxiety, depression, and sleep disorders. They may also lead to substance abuse and even suicidal thoughts. To discuss this then, let's speak with psychiatrist Dr Leverne Mountany. She's with Tabula Rasa Wellness, joining me in studio now to talk more about this. Doctor, grateful for your time. Let's go to the very beginning and talk about what it is about the lockdown measures and having to be alone that triggers all of these emotions.
Thank you for being here, for having me here, Thembekile. I am thinking this is a very important topic, also in the light of Dr. Cindy van Zyl passing, and she's been such an advocate for mental health in this field. If we look at isolation, we are not creatures that are made to be isolated. If we look at previous pandemics, when SARS was here, there was a 2-year period, specifically in the countries where people were isolated, that there was an increase in anxiety, for example, and just loneliness. We are not made to just be creatures by ourselves. We are human beings and we need human contact. And that's been the beginning of this process of increasing the mental health challenges that we are seeing now. And certainly there is a tsunami already here, and it is just growing. It's a year later. If you look at organizations like SADC, South African Depression and Anxiety Support Group, they have increased their call numbers on their helpline from 600 to 1,400 during this period of the pandemic. People are struggling.
And you talk about the additional resources that are now being directed towards helping people who are now battling with loneliness, depression, suicidal thoughts and the rest of it. I'm wondering if outside of SADC, the industry as a whole is equipped to deal with what you've just described as a looming tsunami, essentially.
Unlikely. I think we were, if we see what the prediction was for depression pre-COVID, in 2030 it was going to be the most burdened disease in the world. So already we were in trouble, and now that burden has just increased. And unfortunately, what has happened during COVID is that mental health units were cleared, specifically those in the government, for COVID patients. And so there's still a backlog even from that process that's happening. So I think our resources are few and far between, and they are completely strained at this point in time.
And I've spoken to a number of experts, right, since the beginning of the lockdown, who say that mental health is often the forgotten child of the health services. Do you think then that with more people seeking services related to dealing with mental health issues, this will finally push not just the government but the private sector as well to provide more services, and B, to provide them at an affordable cost? Because as you and I know, sitting across a therapist is not the cheapest service in South Africa.
Sure. Yes, I think, we can just hope that this is going to be a blessing in disguise, that, the fact that there is this absolute need for mental health care and for urgent interventions now, that there is going to be a push for government to actually provide those services, more clinics, more outreach programs. I think just on a practical level, if you look what the UK has done, which has been extremely meaningful, and they've done a lot of research in this last year, they're talking about a campaign called Time to Talk, that people just talk, that they actually just tell people, I'm struggling with anxiety. Anxiety is by far 89% of people in a recent survey said they've had some form of anxiety during the pandemic. So anxiety by far has been the biggest one. Post-traumatic stress disorder, with people having family members pass away. I personally, in the last week, saw a patient that has had COVID himself and was in ICU and had people around him pass away. And that trauma of that. So definitely, I think there's a need that there's going to be an awareness created around mental health.
And without using your services too much for free here, when we have those conversations, language is a big part, right, of how we continue with that. How do we make sure that when we do speak with someone who says, listen, as a friend or as a colleague, I am struggling with anxiety due to COVID-19, they've seen job losses, people don't know if they're coming or going, will we get vaccines, for example? How do I have that chat without heightening their anxiety?
I think it's about creating awareness around what is normal symptoms and what is not. I think if you have the chat with a family member or a friend, be aware that there's normal anxiety too. And I think that we don't want to make everything an illness. But when it starts affecting your functioning, when you don't sleep, you mentioned sleep disorders earlier. When there's a lot of negative thoughts, when your energy levels are affected, all of those things are very meaningful, like early warning signs to see what do you not need to look at seeking help from a healthcare professional.
Dr. Mountany, so good to speak to you today. Thank you very much for that.
Thank you very much.
Psychiatrist Dr. Leverne Mountany speaking to us about warnings that a tsunami, as far as mental health is concerned, is on the way as a result of the isolation that's come with the COVID-19 pandemic.